Hi everyone, it's Onyx. Today I want to info dump on childhood trauma. So without further ado, let's dive into the weird, interesting, and unusual. I want to start this off as a preface. I know I didn't upload the last 2 months. I upload on the 27th, and April 27th, one of my birds had passed away. So I needed a bit of a break, but I'm back now, so I'm glad. So the whole dentistry episode, as well as the disability and mental illness episode, I mentioned my childhood trauma. So I thought I would jump right into everything about it. Everything about it. The definition is the experience of an event by a child that is emotionally painful or distressful, which often results in lasting mental health and physical effects. I wanted to start in the beginning, where, obviously childhood trauma has been around since the dawn of time, especially with how barbaric history has been to everyone, let alone children. I found it very interesting that it was first recognized in the mid 1800s, because usually when you think of history, you're like, oh, they're probably just like, they just said toughen up, like pull yourself up by your bootstraps, which that did happen. But in the 1800s, they had recognized it. But don't be fooled. Many of their treatments were really, really bad. Some of the treatments included being confined to an asylum, which is basically you wouldn't even. Most of these are kids being kids. They get fussy, colicky, that kind of stuff. And instead of treating them like a person, they would send them to a institution. They would institutionalize them, and that would often make it worse. And for the kids who didn't have trauma, developed it because they were sent here. Some of the things that would happen is they would be confined. They would have to. A straitjacket would be put on them a lot. Sometimes they'd be confined from other patients. Very not socialized. They would also deal with rape, abuse, and constraints was probably, because I've been in a constraint before and that sucked. Let me tell you, it was one of the worst experiences, because it's like they can hurt you and you can't do anything about it because you have your arms and like you just can't move. And that's very scary for adults, let alone children. So and due to how many children and people in general were sent to asylums, they were very overcrowded, even by the mid 1800s, which is around the time that childhood trauma was recognized, to the point that most patients weren't allowed to leave. They were so busy dealing with all of these other patients that you would. It's kind of like when you're on death row. People hear death row or the death penalty, and they'll think, oh, I'm gonna get, I'm gonna be killed immediately. But most people on death row don't even get killed chemically or what have you. They pass away from old age or from other inmates, stuff like that. Another type of treatment, quote unquote, is harsh discipline, which that shouldn't need explanation, but just in case, obviously, it would be even more traumatic for the child. Most of their treatments were. They would either traumatize kids without trauma, or they would compound more trauma onto kids who have it. In the 1800s and even the mid 1900s, children would be beat, they'd be whipped, they'd be neglected, they would have their food taken away, all of this. And even going back to institutions and asylums, they used to dunk patients, including children, in ice cold water, and it was called hydrotherapy. It sorry. It's so barbaric and archaic. You'd think this was all, even in the 1950s, you'd think this would be some torture method from, medieval times. But no, it's a lot earlier than you think. And for some kids, they would be subjected to self-medication, which leads to addiction. It usually is addiction. And that obviously would put a lot more stress and pressure on the brain and not allow the child to process things even coming into adulthood. They would make a mix, they called it a soothing syrup. That's what they called it. It was a mix of opium and morphine, and it would put the child to sleep. And the entire premise of the 18 and 1900s is children should be seen, not heard. So if a child is loud or is born with, let's say autism, and they have a vocal stim or a tic, the parents would automatically have one of these treatments. One of the most well-known, at least to me, cases is Rosemary Kennedy. She was an active child, not an aggressive child, but just very active. Sometimes she would fight back. She had a little bit more fight than her siblings. And she got a lobotomy, and they sent her away and never talked about her again. Very upsetting, very traumatizing. It pisses me off, and this is 2026. I don't even know her. And that was awful, awful. Weirdly enough, though, even in the 1800s, there were types of therapies that are still used to this day. Obviously, it's more detailed and developed than it was back then, but they would do things like moral therapy, quote unquote moral therapy. It was along the lines of the founder of Alcatraz, who believed that to rehabilitate offenders and criminals and, inmates was to set a firm foundation of a nutritious meal, being shown kindness or gentleness, and being treated like a human, hearing them out and not just beating them. Although that happened in Alcatraz, it is one of the harshest prisons. I don't want to say ever, but definitely in America's history. And it would mainly be the inmates, but there were a lot of jailers, officers who would dish out punishments, even though, and I say punishments, it was things like, confinement, not letting them do like any of the other stuff other inmates are do. They had a very strict routine, which can also help, but it was to the point that they would get beat or hurt or have more years added on because they didn't walk in a straight line enough. It was that intense. Um, and with children, they added occupational tasks. So a lot of chores and stuff, and teaching them that, there can be a kind of peacefulness of having a routine and you can kind of just get lost in whatever you're doing in a good way, obviously. But yeah. And moving on to the 1900s, the treatments surprisingly got worse. You'd think, you'd think with progression and it being 100 years later that it would be much better, but it was not, unfortunately. Again, there was asylum confinement, which is, what I told you earlier. Lobotomies, of course. They would separate the prefrontal cortex of your brain, which the prefrontal cortex is the part of the brain that doesn't develop until you're 25. Mid-20s is when it's fully formed. And so doing that, doing that obviously was not good for anyone, especially children. But that didn't stop the founder from doing that to a 4-year-old. A 4-year-old had to deal with having their brains separated. Although I think it was the type of lobotomy where they put them under and then, drill into they like break part of your scalp and then, do that. But there was also ice picks used. And the founder for that would make a show out of it. And I'm talking, these people were like spectacles. They would this is the most well known, they would stick an ice pick, and I don't mean, like a pickaxe or anything like that. They called them an ice pick, and it was for a lot of the 40s and 50s, the refrigerators that they had in freezers, they had to use things like that in ice pick. It was, if you look up a picture, it looks kind of like a meat skewer of some type. And they would stick it into your tear duct, going into your skull, and they sometimes would give numbing medication, but most times not. So it was hell for these poor children. I can't imagine being 4 years old and having my brain separated. If anything, you would think, oh, we'll wait until you're 25. But at this time, obviously, they didn't know it took that long for your prefrontal cortex to develop. And although it mellowed out your emotions, it mellowed out everything. And most times, patients would just be left, honestly, in probably a worse stance than they were before they had the lobotomy done. They would just sit and smile, no thoughts, nothing. They wouldn't even, some of them would have auditory or visual hallucinations or feel things, but they couldn't do anything about it because it was like they were a zombie. They had their brain dissected, basically. Yeah. Electroconvulsive therapy. This is something that is still used today. And it was used on children back then, back in the 40s and 50s, there was no anesthesia because, of course, or muscle relaxers. They weren't given, so the convulsions always broke bones. There was never, you could never have it done and not have your bones broken, at least at that time. I actually have a family member who had ECT, is what they call it. She had ECT done, and although it definitely did help, there were more cons than there were pros. And this was 2018, 2019. So even that recently, and they still do it, not only on adults, but on children. And it has to be under the supervision of like 5 doctors. Like they have to be very careful about it. Very interesting, but I feel like that's something we should have left in the past. It's mainly a last resort sort of thing. And obviously, you have to be with a professional. It can't just be, the founder who used an ice pick um, for lobotomies. But yeah, they would oftentimes tell them to bite down on a thick cotton swab or a block of wood so they didn't bite their tongue off. They would convulse so much that oftentimes they went into a seizure. They would wake up. They would be they would say docile, but it was like they're not there. I remember the family member who had ECT had such bad memory issues for about 6 months after the procedure that she forgot where she lived. She forgot a lot of childhood memories, not just the bad ones, but the good ones as well. She couldn't even drive for a couple months because there were different side effects that would make it unsafe for her to drive. And that's in 2017, 2018. Yeah. There was also insulin coma therapy, which is fantastic. It's sarcastic is what I'm being, but yeah, they would put insulin in the 1950s. It had been founded since I believe the 20s, 20s or 30s, and the thought behind this, it was kind of like with Pavlov, it was an accidental discovery, and then they started studying into that. He was trying to develop insulin for people with diabetes. And I almost said customer, when one patient fell into a coma and woke up a different person, they were a lot more docile. They were a lot happier. He decided to study that further. And of course, he didn't just stop at adults, he did it for kids. And the people don't talk about comas enough. All of the side effects, the cons, even if it's medically induced, like to save your life, it can absolutely destroy your life. People often think, they'll watch TV and they think comas, you just snap awake after usually a glucose sort of solution was, put in an IV and that would wake you up. But waking up wasn't just a snap, it wasn't just that. It took weeks, and it's like waking up from a horrible nightmare. Sometimes you can hear what other people are doing, but most times, you will have, hallucinations. But then again, sometimes people they explain it as having a big nap. When they wake up, even in medically induced comas to save their life, they often had to learn to walk and talk again. They can make it back. Definitely, they can go back to, being who they were before. It obviously takes so much work. And yeah, a lot of people died because who knew that overdosing on insulin would do that to you? But that did not stop. And it was I say treatment, it was a fad. It was just like lobotomy that was so widespread, and everyone was like, oh, I need my kid to listen to me. Can you, do a lobotomy? It was like that, but with this. Sometimes it was irreversible, and they wouldn't die, but they would be treated. Kind of like what they do in modern days with life support, like, a machine that keeps you alive, keeps you breathing, and stuff like that. There was also chemical shock therapy, which is a lot close to electroconvulsive therapy. They say shock therapy, they don't shock you, but the chemicals that they would put into an IV would cause a grand mal seizure. And no muscle relaxers, no pain meds, no anesthesia. So they would convulse so hard with how much, depending on the dosage the doctor gave, which is, obviously, it's an overdose. They believed a lot of anti-epilepsy medication would work to treat schizophrenia. And although sometimes people would wake up and act different and be different, it wasn't a good different. And oftentimes bones would break due to the severity of the, they say grand mal, it's a medical term, tonic-clonic. So the tonic phase, it's when you convulse and then your muscles stop and then you convulse again. Very, very damaging, not just to your bones that are broken, but your brain can be permanently affected by that. And a lot of people died. Again, obviously, even in the, as well as the insulin coma, they would give these chemicals to them and it would kill them. Now I want to go into the types of childhood trauma. There's obviously abuse, physical, emotional, sexual. There's domestic violence when it might not be, someone abusing you, but you witnessing the abuse. A lot of people who grew up in broken homes with a lot of domestic violence, yelling, or even hitting, it affects a kid. It affects them because at that young of an age, you see, your dad beating up your mom or demeaning her, and little boys would see that and be like, oh, that's normal. I should do that. And they continue the cycle. It's very hard to break from it, but it is possible. It's a lot of hard work, but it's possible. There's also national and natural disasters or terrorism. So like tornadoes, if your house is torn up, obviously that's going to have effect on anyone, let alone kids. Loss of property, usually houses or cars or, what have you. If debt collectors come and they try and, take possessions because your parent couldn't pay a certain debt, that can be traumatic to a child. Losing a loved one, which is pretty obvious, especially if it's a sudden or violent death, car crash, being shot, that kind of ties in with domestic violence. Things like that. There's also war and becoming a refugee. Not only does, moving already stress people out and sometimes traumatize them, adults and children, but moving to an entire different country where sometimes you didn't even know the language, you'll have to deal with racism. That's another one. Racism, prejudice can cause trauma. Military parent deployment. So if your parent is in the military and they're deployed overseas, if they're in the army and they're supposed to go to war. I saw this a lot as a child in war. It was, in the Middle East. There were so many parents who were having to be deployed, and some of them wouldn't come back. And even if they did come back, the entire time, not only, your other parent or your siblings, but you as well would be scared. You'd start expecting the worst, hoping for the best, but preparing for the worst. There's also accidents or illness. So mine was, an illness, but you can also be in a like one of my sisters. She was in a car crash, um, and she couldn't be in a car for a couple months after that. She had to have other people drive her, and she got treated for it, and she is now feeling so much better about it. But it's scary. Um, Cars are designed to, a lot of them anyways, are designed to take damage, so it doesn't hurt the driver or the passengers. So it might look super crumpled up, and it probably will, but even with a fender bender, it looks like someone, ran into you. And because the car is designed that way, it crumples very easily. There's also neglect, which is a pretty obvious one. When there's both physical, mental, or sexual abuse, as well as neglect, children often say that they would prefer the abuse over the neglect, because if they got starved, if they were confined to a room, it it's not good. They would say things like, even though I was being abused, at least someone was talking to me. At least I was outside of my room, then I'm locked in all day. Stuff like that. Weird fact, 66% of children experience at least one event of trauma before they're 16. And 14 children die from homicide, and 1,300 are treated for physical ailments or abuse per day. Some of the treatments for a lot of childhood trauma is cognitive behavioral therapy, CBT, sorry. And that's basically, it's kind of like talk therapy, psychotherapy. They will explain a lot of stuff to you. And more so in DBT, which I participated in for a bit. It's basically, sometimes they'll have homework. That's what I used to call it. They would send papers home with you and tell you to, read through it or take notes, and it does help because it helps you realize why, especially for people like me, people who are very aware of their emotions and how they feel. And people see that as such a good thing, and it's not. It sucks. But it's good in the way that once I know why I'm feeling a certain way, anxious, depressed, I already feel a little bit better. And there's also trauma focused cognitive behavioral therapy, and that's the same thing except it surrounds just like trauma and PTSD, CPTSD, which is complex. Yeah, more than one event can sometimes go on for years That's what CPTSD is. There's also EMDR, which you would have heard in one of my earlier episodes, but it stands for eye movement desensitization and reprocessing. Basically, and the way I explain it, the way it was explained to me by the EMDR therapist I saw, was the light bar they would use, or sometimes it'll be these little handheld vibrating. I don't know what they're called. It would just like vibrate in one hand and then go to the other hand because you hold two of them. And the thought behind it is there's, when you think of hypnotism, it's kind of like that. It's especially with, stereotypical, the pocket watch going back and forth. When your eyes go back and forth, it connects the trauma part of your brain, like emotional, with the logical side of your brain. So they tell you to think about the trauma, talk about it, feel where you feel in your body, like why, the stress is, it's hurting my shoulders. I feel like I have a really tight chest, like I can't breathe. And as you're explaining this and you're watching the light go back and forth, or you're holding the handheld, I don't want to say vibrators, but that's the only thing I can think of. It's specifically for EMDR. It balances it so you will still have an initial shock of, oh my gosh, going into kind of a panic mode. But for me and a lot of other people, in seconds, I'm able to calm myself down and be like, it's okay. It's not going to hurt. Nothing's going to hurt. Before EMDR, I couldn't even walk into a dental office, since mine was, dental, like medical trauma. I couldn't walk in. I'd immediately go into a psychogenic fugue, a fugue state, dissociative amnesia type thing. And afterwards, I definitely got scared. But it's only for a couple seconds, and I'm able to calm myself down immediately. It's very, very good. I recommend it, but only, you have to find a very good EMDR therapist, because it can also go very bad. If it doesn't go well, you can be even more stressed out. Or, if you have a therapist who says that they know it or they're not very good, it can also cause things like that. But that is the end of today's episode, and I will see you guys later. Bye.